I never grew up thinking, the military was going to be, in my future. I think the biggest thing I took away from my military experience was just kind of the military bearing. I think officer training was very similar to some of the training that I received, how to be a good leader. So much of being an officer is kind of leadership type training and how do you lead other individuals. So I would say that was probably the biggest way the military influenced me. We had a situation when I was in Iraq where all of the hospital beds were pretty much filled up, the ICU beds specifically. We had more casualties arriving that were American who were going to need not only beds but also ventilators specifically, and we had no available ventilators. And so the team of which I was a part of at that moment had to make a decision, and basically the decision was made to determine who had the worst prognosis that wouldn't likely survive despite maximal effort on our part. And that person, then the ventilator was taken off and given to the American, and we kind of transitioned that patient into kind of a comfort care, so they weren't suffering morphine, that type of thing. So that was the only time I really had to make a decision like that, thankfully. That was the hardest thing I've ever done, and probably ever will do. Yeah, you never forget that. Yeah. I was able to be involved with a group of folks coming up with the ethical framework that we would use and some of the tools that we would use. We've never had to activate crisis standards of care at Meriter or in this community at all. But we also developed a mechanism where we would have largely voluntary nurses and doctors across a variety of specialties who would serve as triage officers to help kind of prioritize a list of patients who are needing, maybe in this case, a ventilator, and then help kind of prioritizing, who's first, who's second, who's third, working with palliative care and to have mechanisms in place that we can make sure people aren't unduly suffering in that type of situation. Really the goal of the hospital system in this type of scenario is to do everything possible to avoid getting to that worst case scenario. I think that's a testament to not only UnityPoint and Meriter, everyone in this community made some difficult choices in the interest of the population in general, and hopefully we can continue that. So my hope is that we never see a day where we have to activate crisis standards of care, as that would be a terrible day for everybody, patient and nurse and doctor alike, to have to be in a scenario to make hard choices like that.